Ever get the feeling that gout's reputation is a bit off?
Ah,
Yeah, like it's just a punchline,
right.
about rich foods and kings from history books.
Right, right.
Get ready to have those assumptions challenged because today's deep dive is all about gout. And trust me, it's way more fascinating and impactful than you might think.
You're absolutely right. We're talking about the most common inflammatory arthritis out there,
Really?
affecting millions and men 3 times more than women. This isn't just a historical footnote, it's a very present health concern.
Wow. Okay, so no time for dusty history lessons today. We're going straight to the source. What is it about gout that causes so much trouble?
It all boils down to uric acid. Our bodies produce it naturally when breaking down purines, which are found in our cells and many foods we eat. Now, here's the thing. It's not just about how MUCH uric acid is made, but how our bodies get rid of it. That's where the kidneys come in.
Hmm.
Think of them as your internal filtration system.
Okay, I'm picturing tiny little filters working hard in there.
Hmm.
But from what I've read, things like high fructose corn syrup and alcohol don't exactly make their job easy, do they?
Sadly, no. Those substances can actually ramp up uric acid production. A and D make it tougher for the kidneys to flush it out. Considering how common those ingredients are in modern diets, it's no surprise that gout is on the rise.
That's a connection I hadn't quite made before the way our food environment has changed.
Right.
It's easy to point fingers at things like red meat and seafood, which have that classic gout-inducing reputation. But it seems like there's more to the story.
There is. While those foods DO contain higher levels of purines, simply avoiding them isn't the magic bullet some people think. The real game changer is a holistic approach to diet. And one that often pops up in the research is the DHH diet.
DHH diet. That rings a bell, but refresh my memory. Why is it so beneficial specifically for gout?
It's not just about lowering uric acid, though it does that too. It's about tackling the root problem, inflammation.
Hmm.
DHH is packed with fruits, veggies, whole grains, lean proteins, all of which help combat inflammation throughout the body.
Oh, okay.
This makes it far more effective than just cutting out the occasional steak. It's about making sustainable changes for the long haul.
So it's less about deprivation and more about giving your body what it needs to thrive. Okay, that makes a lot more sense. Now, for those listening who haven't experienced a gout attack and count yourselves lucky, what does it actually feel like when it strikes?
Imagine this. It's the middle of the night, you're sound asleep, and suddenly excruciating pain shoots through your big toe, like someone lit a match under it.
Oh, wow.
The pain intensifies rapidly, usually peaking within 12 to 24 hours. It's not just pain, it's often accompanied by swelling, redness, even tenderness to the touch.
Okay, wow, you're not holding back on the details. It sounds incredibly intense. And while the big toe seems to be the prime target, isn't it true that gout can show up in other joints too?
Unfortunately, yes. While the big toe is common, gout can also attack ankles, knees, elbows, wrists, and for those who also have osteoarthritis, even the fingers can be affected. This isn't just limited to one part of the body, it's a systemic issue.
You know, one of the things that surprised me when I was reading up on this is that gout attacks often subside on their own, even without treatment.
Yeah.
So I have to ask, if the pain eventually goes away, why is it so important to seek treatment at all?
That's a great question and one many people ask. The danger lies in those recurrent attacks that gout is known for. Each flare-up, especially if left untreated, can cause damage to the affected joint. Over time, this can lead to chronic pain, stiffness, even permanent joint damage, severely impacting mobility and quality of life.
So it's not just about putting out the fire of each attack, it's about preventing the whole house from burning down over time.
Exactly. And in some cases, repeated attacks can lead to the formation of these hard, lumpy deposits called tophi. They're essentially crystallized uric acid that can build up under the skin, often around affected joints. Not only can they be painful, but they can also cause deformities, making everyday tasks difficult and, for some, leading to self-consciousness about their appearance.
It sounds like gout's impact goes far beyond just physical pain. It's really important to understand those long-term risks. So let's talk about who's most at risk here. What are the key factors that make someone more susceptible to experiencing gout's wrath?
Family history is a big one. If gout runs in your family, you're at increased risk. But it's not just about genetics. Lifestyle choices play a major role too.
Okay, that makes sense. So things
Yeah.
like diet and weight management, which we already touched on.
Absolutely, those are huge. But here's one that might surprise you. An imbalanced gut microbiome.
Wait, seriously? You're telling me those trillions of bacteria living in our gut could have a connection to gout? Tell me more, because that's news to me.
Research is ongoing, but it's looking more and more like the types of bacteria in our gut can actually influence inflammation throughout the body, including the kind of inflammation that leads to gout.
Wow, that's fascinating. It seems like every day there's a new reason to focus on gut health. It's incredible how interconnected our bodies are.
You hit the nail on the head.
Eh,
Everything is connected. And the empowering part is that we have some control over our gut health through the choices we make.
That's right. Knowledge really is power. So let's say someone's listening to this thinking, some of this sounds awfully familiar. What are the steps they should take to get a proper diagnosis?
The first and most important step is to talk to their doctor. They will take a detailed medical history, perform a physical exam, and potentially order some tests to rule out other conditions and confirm a gout diagnosis.
And one of the key tests involves analyzing fluid from the affected joint. Right. I read that it's the most accurate way to identify those uric acid crystals we talked about earlier.
You're right. Analyzing joint fluid under a microscope is considered the gold standard for diagnosing gout. It allows doctors to directly visualize those needle-like uric acid crystals, confirming the diagnosis. However, it's not always necessary.
Interesting. So are there times when analyzing the fluid isn't needed?
Absolutely. In many cases, a doctor can make a diagnosis based on your symptoms, medical history, and the presence of high uric acid levels in your blood.
That makes sense. But I remember reading that even those blood tests for uric acid levels aren't always a slam dunk when it comes to diagnosis. Is that right?
That's true. While elevated uric acid levels can be a strong indicator, it's not a guarantee of gout. Some people have naturally higher levels without ever developing the condition, while others experience gout attacks despite having normal levels.
So it's not just about a single test result, it's about looking at the entire picture, right?
Absolutely. It's about piecing together all the puzzle pieces, the patient's medical history, their symptoms, physical exam findings, and test results to arrive at an accurate diagnosis. That's why working with a healthcare professional who understands the complexities of gout is crucial.
I couldn't agree more. Okay, so let's say we have a confirmed diagnosis. What comes next? What are the treatment options for someone dealing with gout?
The approach really depends on whether we're talking about treating an acute attack, that sudden, intense pain we discussed, or looking at long-term management to prevent future attacks and complications.
Okay, so two different scenarios, two different approaches.
Right.
Let's start with those acute attacks because I can imagine the focus there is on immediate relief. What can bring that much needed relief during those times?
You're absolutely right. The goal during an acute gout attack is to reduce the inflammation and pain as quickly as possible. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen, are often the first line of defense, as they can be very effective at reducing both pain and inflammation.
Those are medications many people are familiar with, which can make them more accessible. But what about those experiencing more severe pain? Are there other options available to them?
Absolutely. For more severe cases, a medication called colchicine can be incredibly effective. It works by blocking the inflammatory response triggered by uric acid crystals. However, it's important to note that colchicine can sometimes cause gastrointestinal side effects like nausea, vomiting, and diarrhea, so it's crucial to talk to your doctor about the risks and benefits.
It's all about finding that balance, right? The relief you need without unwanted side effects. So we've covered managing those acute attacks, but what about preventing them in the first place? That's where long-term management comes in, I imagine.
Exactly. Long-term management focuses on preventing future attacks and reducing the risk of those long-term complications we discussed earlier. For this, medications that lower uric acid levels become essential.
And one medication I often hear mentioned in connection with gout is allopurinol. It seems to be a cornerstone of treatment for many.
You're right. Allopurinol is incredibly important. It works by reducing the amount of uric acid your body produces, helping to lower those levels in the blood and prevent crystal formation. In fact, the American College of Rheumatology, ACR, actually recommends allopurinol as the first-line treatment for most patients with gout.
That's a pretty strong endorsement. And speaking of the ACR, I came across something really interesting while preparing for our deep dive today. They advocate for something called a treat-to-target approach for gout management.
That's a fantastic point, and it's a strategy that's gaining traction. Instead of just prescribing medication and hoping for the best, the treat-to-target approach involves working with your doctor to establish a specific target level for your uric acid.
So it's about setting a clear goal, like aiming for a healthy blood pressure or cholesterol number, and then actively working towards it.
Exactly. It's about taking a proactive, goal-oriented approach to managing your condition. and it's been shown to be very effective in reducing the frequency and severity of gout attacks, which ultimately translates to a better quality of life for patients.
I love that it empowers patients to be active participants in their own care. It's not just about passively following doctor's orders, but about understanding the why behind the treatment plan and working collaboratively to achieve the best possible outcome.
Couldn't have said it better myself.
Mm.
It's about taking ownership of your health and being an informed advocate for yourself.
Well said. Now, before we wrap up this part of our deep dive, I want to circle back to something we touched on earlier, the stigma surrounding gout.
It's an important point, and one that's often overlooked. The social and emotional impact of gout can be significant.
Right. It's easy to dismiss those old jokes about overindulgence, but the reality is gout can leave people feeling embarrassed, ashamed, even isolated. They might avoid social situations or activities they once enjoyed, fearing judgment or not wanting to explain their condition. It's essential to address this aspect as well.
You're right, those societal perceptions can be incredibly challenging to navigate. It's crucial to remember that gout is a medical condition, not a reflection of someone's character or choices.
Exactly. And like with any health concern, open communication is key. Talking to loved ones about how gout impacts you, both physically and emotionally, can foster understanding and create a supportive environment.
Yeah,
And for those who might feel alone in this, are there resources out there, like support groups or online communities, where people can connect with others who truly get it?
absolutely. Connecting with others who understand the challenges of living with gout can be incredibly empowering. Support groups, whether in person or online, provide a space to share experiences, exchange coping strategies, and even learn about the latest research and treatments.
Right.
It's about realizing you're not alone on this journey.
That sense of community can make all the difference. Now, while we're on the topic of busting myths and misconceptions about gout, I think we need to address the assumption that it's a rich man's disease caused solely by overindulging in certain foods.
Ah, yes. The age-old image of the king with a penchant for feasts and a throbbing toe. It's true that certain foods can trigger gout attacks in some people, but as we've already established, it's a lot more nuanced than that. It's not simply a matter of you ate too much steak, so now you have gout.
Right. It's really about how your body handles uric acid, which, as we discussed, can be influenced by genetics, lifestyle choices, even the fascinating world of gut bacteria.
Precisely. While those images of lavish feasts might paint a vivid picture, the reality is that something like high fructose corn syrup, found in countless processed foods and sugary drinks so prevalent in today's world, can be a major culprit in raising uric acid levels. It's not just about the occasional steak. It's about the everyday choices we make.
That's a really important point. It's not just about what we might consider indulgent foods, but about the often hidden sugars that have crept into our modern diets. And speaking of things we consume, what about alcohol's role in all of this? I know it often comes up in conversations about gout.
It definitely plays a role, and certain types of alcohol are more problematic than others. Beer, in particular, is high in purines, those compounds that break down into uric acid in the body. So while enjoying the occasional beer isn't necessarily off limits, moderation is key, especially for those managing gout.
Moderation seems to be a recurring theme here. It's not about swearing off everything you enjoy, but about making informed choices that support your overall health.
Right.
So let's say someone's listening and they're thinking, okay, this all makes sense, but how do I know if what I'm feeling is actually gout and not something else? What are the key signs and symptoms they should be aware of?
The hallmark of gout is a sudden, intense pain that usually affects a single joint, most commonly the big toe. The pain often starts during the night, reaching its peak within 12 to 24 hours.
It's like gout has a flair for the dramatic, striking in the middle of the night.
Indeed. Along with the pain, you might experience swelling, redness, warmth, and tenderness around the affected joint. The area might even feel hot to the touch. Now, while we often talk about the big toe, it's crucial to remember that gout can affect other joints too, such as the ankles, knees, wrists, elbows, and even the fingers, particularly in people who also have osteoarthritis.
So this isn't just a foot-only condition. It can impact various parts of the body. Now, I know we've touched on this already, but I think it's worth reiterating because it seems like a common misconception. If someone suspects they're having a gout attack, what's the most important step they should take?
Without a doubt, the first and most important step is to see their doctor. I cannot emphasize this enough. While it might be tempting to self-diagnose and self-treat, especially with information readily available online, it's crucial to remember that other conditions can mimic the symptoms of gout.
So even if someone's fairly certain it's gout, getting that professional confirmation is crucial, right?
Absolutely. Seeing a doctor ensures you receive an accurate diagnosis and appropriate treatment. Self-treating can not only be ineffective, but potentially harmful.
Makes perfect sense. So let's say the doctor confirms a gout diagnosis. What happens next? What are the treatment options available to help someone find relief from those excruciating attacks and, importantly, prevent them from happening again?
The approach, as we've touched on before, really depends on whether we're talking about an acute attack or long-term management. For those sudden, debilitating flares, the primary goal is to alleviate pain and reduce inflammation as quickly as possible.
So in those moments, it's all about putting out the fire, so to speak. What are the go-to options for achieving that fast relief?
NSAIDs, like ibuprofen and naproxen, are often the first line of defense. They're generally very effective at reducing both pain and inflammation and are widely accessible. In some cases, your doctor might recommend a stronger NSAID or prescribe a different type of pain reliever.
Now, I remember you mentioning colchicine earlier for more severe pain. Is that something doctors might consider for acute attacks?
Absolutely. Colchicine works a bit differently than NSAIDs. It targets the inflammatory response triggered by uric acid crystals, making it very effective for gout. However, as we discussed, it's important to be aware of the potential gastrointestinal side effects.
Right. So it's all about weighing the benefits against the risks, and that's a conversation someone would have with their doctor. So we've covered managing those acute flares, but what about preventing them from happening in the first place? That's where long-term management comes in, right?
Exactly. And while lifestyle changes, which we'll delve into shortly, are a cornerstone of long-term management, medication often plays a crucial role as well.
Okay, so let's talk medication. I imagine the goal here is to address that underlying issue of high uric acid levels, right?
Precisely. For long-term management, we turn to medications that lower uric acid levels, often referred to as urate-lowering therapies. These medications work in different ways, either decreasing the production of uric acid or helping the body eliminate it more effectively.
And that's where allopurinol comes in, right? We mentioned it earlier as a common treatment for gout.
You're right. Allopurinol is often the first-line medication for lowering uric acid levels. It works by inhibiting an enzyme called xanthine oxidase, which is involved in uric acid production. By reducing the production of uric acid, allopurinol helps to prevent the formation of those painful crystals in the joints.
That's fascinating. It's like tackling the root of the problem. But I imagine, like with any medication, there's always a possibility of side effects.
You're absolutely right. While generally safe and effective, allopurinol can cause side effects in some people, such as skin rashes, gastrointestinal issues, and liver enzyme abnormalities. It's crucial to be aware of these potential side effects and report any unusual symptoms to your doctor.
It sounds like open communication with your healthcare provider is key throughout this entire process, from diagnosis to treatment and ongoing management.
100%.
Mhm.
Remember, your doctor is your partner in managing gout. They can help you understand the risks and benefits of different treatment options, adjust medications as needed, and address any concerns you might have.
It's about working together to find the approach that works best for you. Now, we've talked about medication, but I know lifestyle changes are a crucial part of managing gout as well. What are some of the most impactful changes someone can make in their daily life to help keep gout at bay?
You're absolutely right. Lifestyle modifications are paramount. In fact, for some people, making these changes can be enough to manage their gout without even needing medication.
Wow, that's encouraging. So it's not always a foregone conclusion that you'll need to be on medication long term.
Exactly. Lifestyle modifications can be incredibly powerful. One of the most significant changes someone can make is to their diet. We've already touched on the importance of reducing purine-rich foods, but it goes beyond that. Adopting an anti-inflammatory diet, rich in fruits, vegetables, whole grains, and healthy fats, can make a world of difference.
So it's not just about avoiding certain foods, it's about actively nourishing your body with foods that combat inflammation. And what about hydration? I know staying hydrated is always important for overall health, but is it particularly crucial for those managing gout?
Absolutely. Staying well hydrated is crucial for helping your kidneys flush out excess uric acid. Aim to drink plenty of water throughout the day.
Okay, that's easy enough. Now I have to ask about exercise because I know for some health conditions, strenuous activity is discouraged. But what about gout? Is regular physical activity beneficial or something that people should avoid?
Regular physical activity is actually incredibly beneficial for managing gout. It can help you lose weight or maintain a healthy weight, improve insulin sensitivity, and reduce inflammation throughout the body, all important factors in preventing gout attacks.
That's great news. It seems like exercise is truly a wonder drug. But what kind of exercise is best? Are there any specific types that people with gout should focus on or avoid?
The best type of exercise is the one you enjoy and will stick with. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Brisk walking, swimming, cycling, these are all great options.
So it's about finding activities you enjoy and making them a regular part of your routine. Now, we've covered a lot of ground here, from medication to lifestyle changes, but is there anything else someone can do to support their overall gout management plan? Are there any lesser known strategies or supplements that might be beneficial?
That's a great question. While it's always crucial to consult with your doctor before starting any new supplements, there are a few that show promise in supporting gout management.
Oh, interesting. Which ones come to mind?
One supplement that's gaining attention is tart cherry extract. It's thought to have anti-inflammatory properties and may help lower uric acid levels. Another one is vitamin C. Some studies suggest that vitamin C supplementation might help reduce uric acid levels as well.
So potentially some natural allies in the fight against gout. But again, it's crucial to emphasize that these shouldn't be considered a replacement for traditional treatments. And it's always best to talk to your doctor before adding any new supplements to your routine.
Exactly. It's all about finding the right combination of strategies that work for you in consultation with your healthcare provider.
Well said. Now, as we approach the end of our deep dive into gout, I want to revisit that crucial aspect we discussed earlier, the stigma surrounding this condition. We've talked about the physical and emotional toll gout can take, the importance of seeking support from loved ones, but is there anything else we can do to challenge those outdated perceptions and create a more understanding and supportive environment for those living with gout?
That's a powerful question, and I think it comes down to increasing awareness and understanding.
Okay, I like where you're going with this. Tell me more. I think you're absolutely right. Knowledge really is power, and the more we understand about gout, the better equipped we are to support those living with it.
Exactly. It's about shifting the narrative from judgment to empathy. We need to move past those outdated stereotypes and see gout for what it is, a complex medical condition that deserves our understanding and support, not our scorn.
Well said. It's about fostering a culture of openness and acceptance, where people feel comfortable talking about their experiences with gout without fear of judgment.
Absolutely. And that starts with having open and honest conversations with our friends, family members, even our colleagues. The more we talk about gout, the less stigma there will be.
You've touched on something really important throughout our deep dive today, and it's this idea that gout is often misunderstood. It's not just about what you eat or drink. It's not a punchline. It's a complex interplay of factors, but with that complexity comes the opportunity for empowerment. What would you say to someone newly diagnosed, maybe feeling overwhelmed and a little bit lost on how to navigate this new reality?
I'd say first and foremost, take a deep breath.
Yeah,
It's normal to feel overwhelmed initially. Remember, you're not alone in this journey. Millions of people around the world are living with gout, and there's a wealth of support available.
that's such an important reminder. When you're first diagnosed, it's easy to get caught up in those feelings of isolation, but knowing that others have walked this path before you can be incredibly reassuring.
Absolutely. And don't hesitate to reach out for support, whether it's from loved ones, healthcare providers, or support groups. Surrounding yourself with a strong support system can make a world of difference.
Absolutely. Now, when it comes to actually managing gout, you've highlighted how crucial it is to work closely with your healthcare provider, especially since the research is constantly evolving. What would you say are some key things to keep in mind on that front?
You've hit on a crucial point. Gout research is always advancing, with new treatments and management strategies emerging all the time. What we know about gout today is light years ahead of what we knew even a decade ago.
It's not a stagnant field, that's for sure. There's always something new to learn, which makes staying informed so important.
Exactly. It's not like you get a diagnosis and you're stuck with whatever information you had at that moment. It's an ongoing process of staying updated and advocating for yourself.
And that's where that strong partnership with your doctor comes in. They can help you make sense of the latest research and tailor a treatment plan that's right for you, considering your individual needs and circumstances.
Precisely. They're your partner in managing gout, not just someone dictating orders. Don't be afraid to ask questions, voice your concerns, and work together to find the approach that best fits your life.
It's about taking ownership of your health and being an active participant in your own care. This has been an incredible deep dive, and I feel like we've just scratched the surface of this complex condition. But if there's one key takeaway our listeners walk away with today, what would you want that to be?
If you're experiencing any of the symptoms we've discussed today, that sudden intense joint pain, the swelling, the redness, don't ignore it. Talk to your doctor.
Hmm.
Early diagnosis and treatment can make a worldy difference in preventing long-term joint damage and improving your overall quality of life.
And remember, gout is more common than you think. It's not a sign of weakness or a character flaw. It's a medical condition. And like any medical condition, it can be managed effectively with the right knowledge, support, and a proactive approach to your health.
Absolutely. So be proactive, be informed, and don't be afraid to advocate for your health.
Couldn't have said it better myself. This has been The Deep Dive, and we'll see you next time for another fascinating exploration.